Hello, my name's Julie McCrossin and I'm in rural Victoria in Australia, and I'm welcoming radiation oncologist Professor Sandra Turner, who's in Sydney. Why is it essential, Sandra, that we raise awareness across the world about radiotherapy? Why is it essential?
Well, many patients, even in 2025, miss out on radiotherapy around the world and even locally in our own countries. And because of that, many people die and suffer and don't get the treatment that they require to manage their cancer care.
And is one message you want to get across on World Radiotherapy Awareness Day, the 7th of September, that radiotherapy is equally important to surgery and chemotherapy, or systemic therapy, doctors often call it, that radiotherapy is equal to those other major cancer treatments?
Absolutely. Radiotherapy is a central component of cancer care. In fact, of all the patients that are cured of cancer, 40% of those at least have some component of radiotherapy, except people don't know about radiotherapy the way that they know about chemo or surgery.
And it's urgent, isn't it, to get this awareness among patients, but also about the funders of services across the world, so that the resources are given to radiotherapy and patients know to ask for it. Why is it urgent?
It's urgent because people are dying, and millions of people around the world die unnecessarily each year because they don't have access to radiotherapy services. The problem is made worse by the fact that there's a fear around radiotherapy, which comes from, old-fashioned ideas of what radiation and radioactivity mean that even where radiotherapy services might be available, some patients are reticent to access them, and some patients don't even have treatment because they're worried about the radiotherapy.
If I could just say, 13 years ago, I was diagnosed with stage 4 throat cancer, and my treatment was radiotherapy and chemotherapy. And I realised I knew nothing about radiotherapy. I didn't know what the machine would look like. I didn't know where I would be sitting on or lying on the machine. It startled me how ignorant I was. So is part of World Radiotherapy Awareness Day just trying to get images to patients and other clinicians about what actually modern, sophisticated radiotherapy looks like?
Absolutely, it is, Julie, and you're not alone. I mean, it's not just patients and their families and carers that don't know about radiotherapy. Many health professionals as well, unless they're directly involved with radiotherapy, don't have adequate education or awareness of it. And that can also impact patients being appropriately referred and getting the treatment that they require.
And your theme for this very first day is One Voice for Radiotherapy. One Voice, what's that about?
That's about bringing the whole radiotherapy community, professionals, people that have been touched by radiotherapy, people that have had radiotherapy in their families, bringing everyone together to amplify our voice around the need for better awareness and access to radiotherapy around the world.
So for this World Radiotherapy Awareness Day on the 7th of September, leading up to it and on the day, what do you want health professionals and radiation oncology professionals to actually do?
We want people to go to our website and look at the fantastic resources we have there in the toolkit. This will give them ideas about activities and events that they could run on or around the day. We want people to take photos, get involved, be creative in deciding things that they can do to promote World Radiotherapy Awareness Day. We want people to follow our socials and make sure they're sharing with their networks and patients and everybody that radiotherapy touches some of the great work that's happening in advocacy around the world.
And Africa is obviously a huge continent with grave need for more technology and trained staff to help cancer patients with radiotherapy. But there's already some action afoot in Africa, isn't there?
Yes, we've had some of our most amazing supporters coming out of Uganda and Tanzania and other African countries. They've already sort of set up pre-celebration events with fun runs and social media and presentations. They've put their logos on T-shirts. And I think this tells me that the passion that there is all around the world to have a vehicle and a common place like this to share and spread the World Radiotherapy Awareness Day movement.
You want this to be a movement. What do you mean?
Well, we do know that awareness days do help people have some recognition about particular health ideas, but obviously an awareness day is not going to change the dire need we have in many countries for radiotherapy, and it's not going to improve awareness overnight. So this is a way we can amplify our voice, we can come together, we can get inspired by others to have an intensity of events over this period, but this will be something that will happen year in, year out with a lot of activity in between to make sure we're constantly joining our voices together to continue to raise awareness of radiotherapy for the benefit of the patients everywhere around the world.
Well, I just want to reassure you, I'm from Adelaide in South Australia, many kilometres from where I am right now, and a group of cancer researchers who've never seen a radiation therapy machine. Some of them are called LINACs. They've never been into a bunker, and they're all going to go there before this special World Radiotherapy Awareness Day and have a guided tour and an opportunity to ask questions from a radiation oncologist. So you've inspired me as a survivor, as they say. Thank you for talking to us.
Thanks very much, Julie.
Well, I've moved now to Adelaide in South Australia, and we're travelling to the United Kingdom to welcome Dr. Katie Wakeham. And Katie, I think you're in Lewis, Sussex. So how exciting. We're talking about global action, and we are on opposite sides of the globe. So welcome.
Thank you so much.
Now, I know you're one of the prime movers, along with Sandra Turner, who we've just been speaking to, about World Radiotherapy Awareness Day, 7th of September, but also a whole movement. Why do you personally feel so strongly about this? Why does this really matter to you, this action?
It comes from my experience of working in the radiotherapy field, both in the UK, but also in Uganda, and seeing having the personal experience of seeing the challenges that patients face trying to access radiotherapy. We know very well that, access to radiotherapy can vary significantly, based on where people live or their socioeconomic background. And that's an issue both in countries like the UK, and also an issue globally.
But it's so much more severe, isn't it, in places like the many nations in Africa, parts of South America. Give people a sense of just how few of the machines, they're sometimes called LINACs, and other technology are available in some African countries.
Well, we know that in some African countries there are no radiotherapy facilities, there are no machines. So that would be an entire population who would face, an incredible challenge to receive treatment. Many countries in Africa over their last decade have started to develop their radiotherapy services. There's a massive credit to the governments of those countries, but that's still often one or two centres for populations of tens of millions of people.
And what does that mean for an individual patient? Can you give me an example of what that might mean in terms of the different treatment you might get and what that might mean for you physically and for side effects and the rest of your life?
So we know that timely access to radiotherapy improves survival, improves cure, and also quality of life. And if you're in a country where you're needing to travel and potentially pay for access, that's going to mean that many individuals or many families just are not able to do that or to support that process.
There are issues within the United Kingdom as well, aren't there? Depending on where you live, is that correct?
Yeah, so we know that, where you live influences how many cancer patients receive radiotherapy. So an estimate of the proportion of patients that should receive radiotherapy as part of their treatment pathway is about half, about 50%. And, a recent publication through our radiotherapy data set has shown a marked regional variation in the proportion of cancer patients that receive radiotherapy, as low as about a quarter, about 25% in some regions, up to 50, 60% in others. And we don't fully understand the factors about that, but I think that's, it's a concern. It's something that we urgently need to address.
You're all about action and about change. What's your key message to health professionals watching our discussion? What's your key message to them about World Radiotherapy Awareness Day and the movement, the action you want them to take?
I think, particularly for health staff that might not be radiotherapy professionals but working within cancer control, educate yourself, be aware that half of patients require radiotherapy as part of their curative treatment, and always consider that for the patients that you come into contact with. And also advocate for your patients, perhaps if you're a surgeon or a nurse or a medical oncologist, perhaps dealing more with the systemic chemotherapy side of cancer treatment, work within your multidisciplinary team. And really advocate for patients to have radiotherapy if that is considered the right thing for them.
You say inform yourself. Could I just say, as a patient, a former cancer patient treated with radiotherapy, I've been shocked how many members of cancer teams who are involved with chemotherapy or surgery have never actually been into a radiation bunker and seen a LINAC, that they're actually in a cancer team. So I feel like saying to people, organise tours and inform yourselves, get a guided tour at the end of the day.
Yeah. And I think as part of World Radiotherapy Awareness Day, when we're asking people to organise events to kind of mark the 7th of September, something as simple as that, bring your MDT into your hospital's basement to see those machines, would be a great thing to do.
Yes, your multidisciplinary team. And if you provide food, people will usually come. So we need to gather with food around the technology of radiotherapy and explain what it does. And your key message to members of the public who may, know nothing at all about radiotherapy, but they're a little nervous about the word radiation. What do you want to say to them?
I think it's important to feel that, you understand what it is, that it's sort of high energy radiation, that it's an immensely targeted treatment, and it's also a very safe treatment. It's very highly regulated in the facilities and in the countries that provide it. And to know that it's a very common part of cancer treatment, both on its own or given with surgery or systemic treatments.
And I think it's important to say that you don't feel anything, because I didn't realise until the day I was waiting for the first of my 33 sessions of radiation therapy that I'd forgotten to say, will I feel anything?
Yeah. I mean, I think that comes from, people such as myself, radiation oncologists, clinical oncologists, informing ourselves on how we talk about radiotherapy and how we, consent patients. We do tend to focus on side effects, which is important for people to understand, but perhaps not saying some of the things that patients need to hear.
If
you don't feel anything, you don't see anything, it's safe.
Exactly. You don't see anything, you don't feel anything, it's safe. That's great. Look, turning to the global focus, it's World Radiotherapy Awareness Day, the 7th of September. If you have a dream vision of the future and look forward 10 years and this advocacy has been sustained. You've been in partnership with Radiotherapy UK, I know, an advocacy group within the UK, but also with all your global partners. What's your vision for the future?
So I think the success of World Radiotherapy Awareness Day is really to get everybody knowing and talking about radiotherapy, and through that kind of pave the way for better access. And I think there's sort of that stepwise process of improving access. It's about stronger advocacy to policymakers so they prioritise funding for radiotherapy. It's about educating not only other healthcare professionals, but also patients and policymakers about what radiotherapy is and why it's so important. I think there's a really key thing about increasing multidisciplinary care models or discussions about individual patients' cancer treatments so that radiotherapy is always considered. And of course, recognising and supporting radiotherapy professionals.
Yes, the beloved workforce.
Yes, without which, there will be no radiotherapy access. So.
And can I just say, all the way from the other side of the globe here in Australia, I've been watching the work of Radiotherapy UK as well as your own work, and you've been doing much of that public lobbying in front of Westminster, visiting politicians, involving cancer patients and survivors and family. You really have, there's a great model of advocacy there that you can build on, can't you, with World Radiotherapy Awareness Day?
Yes, absolutely. I mean, this is our foundation year for World Radiotherapy Awareness Day. And we felt this foundation year, it was very important to get the radiotherapy professionals and our major societies and industries in with RAD, in for the movement, and then building in subsequent years to involve and hear the voices of patients. And then through that, really start to push the policymakers to start thinking about radiotherapy and funding radiotherapy. Yeah, we'd really like to show kind of global reach and sort of a global one voice for radiotherapy. And so we're really sort of asking people to follow World Radiotherapy Awareness Day on our social media sites, and to sort of really post and share messages about radiotherapy. And that would be absolutely fantastic to show not only the significance and the number of people out there, but also the kind of growth of this global movement for radiotherapy.
And also to encourage all the members of the multidisciplinary team to get on whichever form of social media they like and use pictures. You get so many more views if you use pictures. Look, I just wanted to say how delightful it is to speak to you in Sussex. My English grandmother lived in Sussex at the end of her life, and I used to visit there. So, like so many Australians, we reach across the globe. But a delight to talk to you, and congratulations and thank you as a cancer patient myself for your marvellous advocacy. Thank you.
Well, thank you so much for this opportunity.
Bye.
Bye. Thank you.